Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Clin- Clinical manifestations of increased androgen. The clinical manifestations of increased androgen include 1. Clinical manifestations of polycystic ovarian disease, which are due to increased androgens. These include 1. Hirsutism. Hirsutism. In hirsutism, there is growth of excessive terminal hair are seen, which are thick and coarse in male pattern. Acne is the second most common manifestation. Acne does not respond to usual treatment. Acne can be scarring in nature. Androgenic alopecia is seen, and there can be dyslipidemia in the patient. Hirsutism. Hirsutism is the most common cause of hirsutism is polycystic ovarian syndrome. Most common cause of rapid onset hirsutism is androgen secreting tumor. So main clinical features are hirsutism, acne, androgenic alopecia and dyslipidemia.
thank you and thank you for watching.